Welcome to HealthTech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Rouse, a seasoned entrepreneur, sales leader and co-founder and head of growth at Savva. With a career that spans from launching a successful company on Kickstarter to closing over 30 million in SaaS sales, Stephen has a wealth of experience in the entrepreneurial grind. He is now channeling that energy into Savva, an innovative company at the intersection of healthcare and lifestyle medicine. Savva has developed an on-device AI medical concierge that connects electronic health records with fitness variables, providing patients with a personalized, proactive health insights while prioritizing data privacy. Stephen, welcome to HealthTech Heroes.
Thanks for having me, Fasa. I'm so excited to be here. I can't wait for this conversation.
It all started with your journey, which is far from typical. Can you take us back to the beginning of your venture, Really Big Glides? What was the spark for that idea, and what gave you the audacity to walk into Home Depot's headquarters unannounced?
This was 15 or so years ago now, in the beginning of my career, and still one of the best stories I have. And I have such fond memories, especially this time of year. Actually, I just was hanging my Christmas lights up this past weekend with my son, and it just brings back so many fond memories. I unfortunately can't take credit for the spark of the idea. There's a guy in my hometown here. He's a Pixar executive who's in my hometown of Sonoma. And years before the Really Big Lights venture, he had brought a glass version of some really big Christmas lights, which I assume came off of like a Disney backlot or something. And they're really cool and made of glass, and put them out in his house for 1 year. And my father was able to get them from him, and we hung them on our house as when I was a kid for years and years and years. And when I graduated college, I had been living in LA, and I started a company called Juice Me, which was this whole idea of providing premium raw juices to people, and by making a sort of like a juicero is a company that ended up doing exactly what I wanted to do. If people out there are familiar with juicero, the idea of sending vegetables and fruits to people's houses and having a machine kind of produce that for you. And it fell on its face, thank God, before we got too serious into it. And when the company fell, I was home for Christmas, and I was out on my parents' front porch. And as people had done for years, we'd get in the newspaper over the years for our Christmas lights decoration. And maybe 1/2 hour of me sitting out there a little bit down, trying to figure out what I was going to do after Juice Me didn't become anything. 3 people within maybe 30 minutes, "Hey, where'd you get those lights, dude? Those are cool lights." And I tore one down and I looked at it. I said, I could probably make a smaller version of this and make it out of polypropylene or some type of plastic. And I went full on it. I got a 3D printed prototype made. And your next question about Home Depot's corporate headquarters, I took a buy signal, if you will, from a junior buyer of Christmas lights on LinkedIn, who basically responded to my connection request and sent me maybe one message of like, "Hey, yeah, that looks cool." And in my mind, I was like, I need to fly to Atlanta and go to Home Depot's corporate headquarters. When I got there, I didn't think it was going to be like 5 skyscrapers and a massive campus. It's probably the first big corporate campus I'd been on in my life. And I showed up, and the guards were like, "You don't have a meeting?" And I was like, "Oh, I do. Yeah." I just kept naming this individual over and over and over again. And maybe 5 or 6 hours later, this junior person's assistant came down into the lobby, and I mean truly an elevator pitch, as they were kind of took my sample and walking towards the elevator, just talking about my big Christmas lights project. And it ended up netting, got nationwide distribution that following Christmas, and worked with Home Depot for 3 seasons in total, getting that product into their Mexico stores, or every store in the United States. There's a few other countries that Home Depot, I think Guam, got this product, kind of all over the place, just by showing up unannounced at Home Depot's corporate headquarters years and years ago.
Looks like your LinkedIn premium paid off, huh? That's awesome. And then you also described your time in China scaling that business, because you did mention at the Home Depot office in our pre-podcast conversation that, you have production line on, on, and you did go to China for scaling the business, and it was wild, messy, and a slap in the face business education. Can you share that pivotal moment and specific challenge from that period fundamentally shaped you as an entrepreneur?
The wildest part of that is I left Home Depot's corporate headquarters with a PO, and I was under the assumption I can go to Monroe, Michigan, or somewhere in the Midwest to get these things made domestically. And I like knew I needed to get molds made, and I think it was January when I was there, and I kind of figured we'd have until October, November to deliver Christmas lights. But it was the first big surprise was that they wanted it in their DC starting in May. And at that point, I didn't have molds, I didn't have money, I didn't have Underwriters Laboratories figured out, which is like the huge red tape part of it, where you have to get, this third party and UL to test it and do all that stuff. So I stopped first in Monroe, Michigan, and I found out the pricing that I had given Home Depot. They looked at me and said, "Dude, there's no way." They literally told me, "You've got to go to Shenzhen, China, dude, and do it over there." And so I very rapidly, I was like, I have 5 months to do all of this. And part of me was like, maybe I should just kind of be honest with these guys and tell them I'm not really prepared for this. But I was so just driven and willing to do anything it takes to get this order done. And I moved to Shenzhen and was like sleeping in a factory in Guangzhou, Guangdong for a long time. And that comes with its own challenges in and of itself. That's just the first part. But we delivered that first order it was like 95 40-foot high cube containers distributed. And I didn't know anything about freight forwarding. I didn't even know what a bill of lading was. Like, I was so naive. And slap in the face education. I mean, we delivered every one of those containers and we sold out in Home Depot that first year, which kind of boosted us. We were able to get into, other retailers because of it. At the end there, it was a really awesome story and how we got there, but it was just as awful of an ending. A couple years later, maybe 3 years later, I was in Hong Kong then. I ended up getting sued for prior art infringement on my own patent by a number of publicly traded Chinese trade companies in one day, which still, when I think about it now, it just a heart-shattering moment.
Okay.
Like, I thought I did everything right, and at the same time, like, what a compliment, right? To having big companies like that paying attention, and having to shut down the business in a really awful fast way, and it started just as fast as it ended, unfortunately. But I've always said that I got a master's of business administration. I had my own MBA, but in real time, in the real world, learning as I went. And it was still, from an entrepreneurial perspective, I traveled the world. I was working out of hostels for most of that time in Southeast Asia. I'd just be like down in Luang Prabang, Laos, slanging Christmas lights to retailers. It was just an amazing time. And I have very fond memories. More fond memories than bad ones. Definitely some negative energy that came out of that whole thing.
Sometimes lessons are super valuable too. And if it came out generally in positive with lessons and something to show for it, I think it might be okay. But did you actually have traveled 100 countries? Did your passion for travel start there, or was it always there?
It started just a few years before that. My parents, I wasn't much of a student. My whole career in college and high school, and even before that, kind of just, skating through all of it. And I didn't really know what to do. Going to college, what major to do. I wanted to maybe be an attorney or go into law school, but that meant more school. And honestly, my parents wanted me to go study abroad. And I was like, dude, I don't want to do that. I don't know about that. And then I got accepted to an exchange program in Russia, actually. And then my mom and dad were not okay with me going to Russia. I thought that with my big mouth, I might get in trouble out there. And so I settled, and I went to, I studied abroad in Florence, Italy, of all places, and went for 3 months. I studied and did a fair amount of travel during the study of when we were in classes. And then I took a semester off of school in the following summer, and I forget the number, maybe something like 25 countries between Western Europe, Eastern Europe, and a little bit of the Middle East. One story I know that I haven't told you yet, which is great, really quick one. During that trip, I was alone in Egypt for the first day of the Arab Spring. It was I was backpacking, and I was in the National Museum of History on Inter Square the day that King Tut's
Oh,
tomb got raided, and they shut down public transportation in the whole country, and I had to walk like 14 hours back to where I was couch surfing. During those days, there was no money at all for anything. And so I had to walk maybe 14 hours back to this gentleman's house who was kind enough to host me. Man, the next day, Obama ordered all the Americans out on
okay.
government planes. That was the end of that trip. That was the tail end of that experience. And when I came home, I had the bug. I
Oh,
totally
okay.
had the bug. And then I came home, did 1 year of college, and then the first day after college, I went and I bought a motorcycle in Hanoi, Vietnam, and spent
Ah,
weeks traveling through the entire country, like zigzagging down the coast of Vietnam all the way to Ho Chi Minh City. And I'd say the travel bug happened during study abroad. And thank shout out to mom and dad for forcing me to do that. It's completely shifted my whole mindset. And yeah, some of my fondest memories have happened outside of this country with a backpack on my back.
every country gives such a great perspective on just life. There was once one scene in Motorcycle Diaries by Che Guevara. If you have seen the movie, The Motorcycle Diaries.
You talked about it last time. I haven't seen it yet.
Yeah, yeah. And he says, I don't know if the landscape is changing or I am changing because everything looks different.
Oh
So,
wow, it's a beautiful
yeah,
quote.
yeah,
I just got chills. I mean, I mean, Americans don't travel enough. We got to
yeah,
get out there and get
yeah,
perspective and realize that, 99.999% of us in the world are all the
yeah.
same. That's a revelation that I can't wait for my son to start doing some backpacking with me when he's old enough, because I feel like I kind of turned into that person at like age 20, 21. Oh, I wish it would have happened 10, 15 years earlier to have
And
that.
it's a process as far as we arrive there. I want to step back a little bit more before we come to the next question is that after this experience, which has almost nothing to do with healthcare and health tech, why did you even get into this health tech, healthcare? Is there any background, like as a child or something that kind of sparked, like, let's get into health tech. I want to do this. This is what.
Right there at the end, when I got when the Chinese manufacturing was coming to an end, and I was kind of having to grip the reality of what had happened to my really big lights product and company. My passion has always been skiing. My grandfather was retired as a ski instructor, and got us up on skis when we were really young. And so I went to Japan to go skiing during like my last right at the end there. And I met a gentleman on a chairlift, telling him the story of showing up unannounced at Home Depot, and kind of a similar story that we've covered here today already. And he ended up, kind of, I don't know what it was, my energy, or it certainly wasn't my math and science skills.
Okay.
Um, at all. Decided that I could be a good fit working as the first hire of a a biotech company. And he was just as long as I moved to the Bay Area, I could
Okay.
have it. And I said, hey dude, I'm born and raised in Sonoma. I think that's doable. That's 35 minutes from where I was born. So, I got in by total chance and luck, I like to think, but I kind of got bailed out by some individuals who were building a very cool product called Clinical Pipe for
Okay.
for a company called Protocol First, and still really close with that whole team. The CTO of that company, Amit Shah, is my current CTO of Savva, and both the co-founders of Savva. So it created just an awesome opportunity for me, and I went going from Christmas lights to clinical trials software. I couldn't believe it. I thought it was a pretty good trade, and so I moved home immediately and got started on that company and that product. And I don't know if it's getting too far ahead, but 3 years later, we ended up selling that company to Roche, and it was a total success story, and
That's
kind of
awesome.
furthered my development as an entrepreneur. So I had equity, and um, working with the executive team there, just a group of really intelligent, really kind individuals that were able to kind of keep my career kind of progressing in a forward and upward way.
And you said like intelligent and kind, and there are so many attributes you have to have when you're in healthcare because that kindness part is a huge thing, right? And you have to think about the patients first always because you can impact patient outcomes quite dramatically in this position. Tell me, can you draw a line between the high stakes and tangible world of manufacturing and global retail? How did it prepare? Were there any lessons that you brought directly to the health tech space that speaks to it? Like one or two examples.
In all business, there's a bunch of different schools of thought on this, but it's a battle of attrition. And in business, I always have found, and I've had mentors over the years that have told me in business is not about horse betting, it's jockey betting.
Okay.
People want to know who's running the show. And so I found that out over the course of the Really Big Lights experience and have carried that through Protocol First and other companies into Savva as well. Being truthful, being organic, not using automation, looking at somebody in the face, having a conversation like you and I are now, and building trust, just like human beings have for 30,000 years or however long. I'm not a historian, but right. I think that it carries over and I think one big part of working with big box retail is in its similarity to healthcare is it's overregulated. There's so much red tape you have to cross as a barrier to entry to even get in. There's gatekeepers. There's so many checks and balances when you're working with selling containers freight on board and over the Pacific and seeing it, go to distribution centers. There's so much they ask you to do from a regulatory perspective. Not as much as healthcare, but when I got in, it's the same kind of process. You have to build trust. Sorry, you have to build trust. You have to really check off a lot of vendor qual and third-party risk assessments, security and privacy. I'd say that definitely carried over, as well as just the grind, man. It's right. I'm a last man standing kind of thing, right? It's a battle of attrition. It's the only way that things don't work out is if you quit and if you stop believing in the message and you stop drinking the Kool-Aid. And that's the same thing when you're upward battle with a massive retailer as you are with a massive pharma or a healthcare institution. You just gotta stick to it, and it's gonna take a long time and a lot of effort to get in. But once you're in, you're in. And I think there's a lot of similarities between those two.
I completely actually miss the impact of a big retailer because you are selling products that you are going to connect through wires all around your house and lighten them up. And that needs certain amount of quality control, and not certain amount, I'm pretty sure, because you are going into thousands of homes, like their life savings depend on your equipment working well. So I see that I miss that part and I appreciate it. Maybe because you undersold it. Oh, lights to Christmas lights to healthcare. No, it's not just from Christmas lights to healthcare. It is something big. So coming back to Savva itself, what is the core problem you saw in healthcare landscape that led you and your team to create an on-device AI medical concierge?
First and foremost, there's been a shift to patient-centric healthcare, and a lot of that is due to what the regulators have done in recent years. We're kind of following in the wake of the 21st Century ONC Cures Act, which I'm not the best versed at talking about the history of healthcare democratization over the last 30 years in this country, but it's shifted from the insurance company having full ownership of this data to maybe the healthcare institution to the doctor to, okay, let's give the patient a certified copy of this and they can have access to it versus like, hey, no, we took blood out of you. That's your data. And so that the ONC Cures has been it's been happening for 10, 15 years. But the final guidance in 2021, I think has really shown that, this country specifically, a perfect example of this shift to patient-centered care. I think that what goes into that is the value-based care models are not going away, and you see this massive shift in let's not just worry about Steve getting lung transplant 15 years from now. Let's have Steve make steps so he doesn't need to have
Need the lung transplant.
from a lifestyle medicine and preventative medicine perspective. I think that it's way overdue in this country, maybe even worldwide. But I think that's the biggest shift is people having access to their data so that they can use diet, sleep, exercise as a way to help manage chronic conditions, as a way to prevent chronic conditions, and even reverse. Type 2 diabetics are reversing their diabetes today, not just being treated with insulin. And I think that it's this whole shift, and we're trying to kind of attract ourselves to that side of healthcare because I think the shift is undeniable.
The major question here for me when I listen to this, it is basically preventive medicine.
Yeah.
And having people pay for preventive medicine is a challenge because now you are asking people to pay for something that really does not have an outcome. Technically, because you're seeing that you don't have an outcome, so there is nothing to show for it. Like, hey, you would have gotten a heart attack, but you don't. But that's not as convincing as, like, you have a heart attack, we are going to treat you. People will pay for you. But it's a preventive thing. But I have an idea about the answer because we spoke about this. But how are you making sure that people have access to this? And how are you removing or reducing that barrier to access?
There's something like 130 million people who are living with a diagnosed chronic condition in America today. The problem is, that person probably has upwards of 4, maybe more patient portals. I'm an undiagnosed individual and I have 4 patient portals. And it's like if you go to Stanford and then you go to UCSF, you have to be in 2 different my charts. You can't be on your phone at both at the same time. And so we're enabling people to access their health records via a third party like us. And we're connected to 300,000 hospitals, doctors' offices, and clinics, right? To get, even if you're not wearing one of these, just anyone who has health records has more than one, and being able to have that all in one place so you can see the full picture of your health. And then when you add this stuff in, it's a cherry on top. And just trying to connect the dots between these siloed data sets is kind of the promise of Savva for the first generation of the product. The AI and the clinical significance and the output will get better and better over time. But right now, the first problem that a lot of people have is, just for me, I've got a Garmin, a Whoop, an Apple Watch, Withing Smart Scale, a Sleep Number mattress, a Peloton, a sauna. I mean, all of those things are different health and wellness longevity apps and products that, for me, I have to sit there and spend a lot of time. And the whole idea of just, okay, let's have all of that data in one place and explain to you, as opposed to just showing charts. And so that's how we're, beginning this.
And you're bringing all this together. There is one device that connects all this data together. And you mentioned which device was this, and it was the Apple Watch can access everything. So if you have access to Apple Watch, you have access to your EHRs and your day-to-day metrics as well. And when you put this together.
So not just Apple Watch, right? Actually, Apple Health. If you would go to your Garmin app today, I have my Garmin in my hand. I use my Garmin on the weekends when we're doing backpacking trips because they got, better GPS and you can have better battery life. If you go into Garmin, you can click a button to go share with Apple Health. If you're on Oura, you can share with Apple Health. If you're in Whoop, or if you're on glucose monitors, if you're on a Fitbit or a Samsung product or a Google product, all of those products, hundreds of them, have one thing in common, that they talk to Apple Health. And so not just to the Apple Watch, but it's a way to put all of that data, instead of going through the silos and getting an API to Garmin, an API to Whoop, an API, and they're already sharing that data to one, general repository. And all we are doing is we plug into that and educate when we started this venture, I couldn't believe that my Sleep Number mattress connected to Apple Health. And it was one of those things like, wow, I can't believe over the last several years, because I have to go into 2 apps, my workouts and my step count and my VO2 max over here, my sleep somewhere. No, now today, like every morning I wake up, it's my favorite thing to do is I go into Apple Health, and it's getting data from my Oura, it's getting data from my Sleep Number mattress as well. That's that side of the business, on the wearable side of how we're doing things.
So my main question to you was, how are you making it accessible to me if I want to get on your platform? Do I have to go through my insurance? Do I have to sell my first bond to get access to this? Are you making it difficult or easy for me?
The easiest. This is a consumer-facing tool. So when we launch at the beginning of next year at this rate, when we're actually on the app stores, you can download this tool off of the App Store. It doesn't need to go through your physician or via your insurance company at all. And so that's the first and foremost. This is, again, consumer health. This is something that's relatively new. Because of the ONC Cures Act, we're able to do this. And so that's the first part of that. We also don't have account levels at Savva. We have certain competitors in the space that they ask you for your social security number as you're connecting your medical records. They ask you for your email address, your cell phone number, your physical address, maybe even a copy of your ID with like a selfie picture next to your face. And that's because, no secret, a lot of people are in this space for all the wrong reasons. They're selling your data to the highest bidder, maybe to an insurance company or whoever it might be, an advertiser. And I know the first three letters of HIPAA stand for health insurance protection. And I think there's a lot of companies in this space that kind of lost track of that. I don't think the American consumer wants their data in the hands of people. So I think that that's another thing. We don't have accounts. And then I know that we probably will get into a little bit of the on-device AI, but we don't operate our LLM in the cloud. It rests on your device, which is security and privacy. It's like one of those things where I can tell you that we're not collecting your data on a privacy policy. I can tell you on this call, I can lie to your face, but it's really, if it's not in the cloud, we feel like the average consumer, it's like you can be on airplane mode 40,000 feet above the Atlantic Ocean asking this thing questions and the device temperature kind of heats up. It's not scary, just like, because it's doing the thinking on the phone. Oh, it's not using the internet. So we don't have any access to it. Your everyday run-of-the-mill hacker can't get into it. It's not running on the cloud. We can't train our LLM on your data. And it's all because it's resting on your device. Another kind of way we're trying to bring it to people and bring it to the masses. And lastly, it's a $5 a year annual subscription. It's from a health equity perspective, we want to get every single person on this thing and to have population density and do that in a way that's safe and secure, and we're not selling people's data. And that that $5 a year goes a long way if you have a lot of people on it. And that's another thing, the level of access. We feel like there's a huge value add for that amount of money versus, we have other people in the space that are charging a crazy amount. Like, there's no way it should cost more than Netflix a month is my first thing. And so that's kind of the business model as well.
So let me put a pin on this. I want to highlight everything that you said, which is super critical, is that you're not going to sell the data because you actually do not have the data.
Correct.
And you are not training your models based on your customers' data, again, because you don't want to do that, and you're keeping all their data on their phone. And anything that is happening on their phone. So you have taken care of the security also. Data is so precious. Everybody is going in that direction to take patient data and process it and make it their own. They're going in the opposite direction, respecting the patients. So I want to really be clear about that. And the third thing is you are going to get access to all this data in one place, your EHRs and your wearables and everything in one place for the cost of your morning coffee. For getting it for 1 year for the cost of your, less than the cost of your morning coffee.
All correct.
That is
yes.
All correct. So
yes.
I'm understanding this right.
Right. It's not in the interest of any consumer. I don't care where you are. We're talking about intimate data here. We have to be empathetic that this is data that people keep private for a reason. The whole fear forever has been for an insurance company to find out Steve's pre-diabetic using their fancy algorithms. Like, if they'll get access to this stuff and my blood work and my medical history and my conditions and procedures that I've had over the course of my life, there's a lot of money and a lot of smart people at those companies that the biggest fear is, hey, they know I'm pre-diabetic 10 years before I know I'm pre-diabetic. So they shoot up my family's premiums until the last second when they decide not to cover me at all. Maybe we're sitting there wondering what to do next. Or maybe I'm going for a job interview one day and it's between me and one other individual. And they go, well, we have this data on Steve. Why would I hire Steve? He's pre-diabetic versus this healthy individual. And that's that. I mean, I think these concerns go back to like the late 90s or the early 2000s. Absolutely. In terms 100%. Of trying to move these, when electronic health records kind of became, a mainstay, if you will. We're just trying to, mirror that. Generational, maybe. I think maybe the younger generation just goes whatever with their data. But I'm building this app for my parents and for people that are. And there's so many reasons that you don't want your data to be out there. Even to keep data from your loved ones. It's not necessarily to keep it from an insurance company. It's like I just had my prostate removed, and I don't want people to know
get
about that.
stressed
There's a
out about
lot
it.
of people. This is stuff that people talk about with their significant others at the dinner table every night about data points that they're tracking, and it's going to kill them one day. And we need to, straight up, we need to be very careful with this data, and it needs to be respected. And again, empathetic. And this is not like a flashy, sexy thing here. This is
This
hey,
is
did you
serious.
manage? This is serious. You're managing a chronic condition, and we're just trying to give people a tool to enable them to manage it more efficiently, and also with a super big focus on privacy and security.
And I really wanted to spend some time on this topic because it is, I think, in healthcare, these decisions made by a private company is huge. And I think it's a really good example for people to look at and say that, hey, we can actually make business by doing the right thing too. So could you share a success story that Savva had to bridge the gap between clinical healthcare and users' day-to-day lifestyle data to make a real difference? Is there a story that you can share without, of course, identifying the patient or patient data?
Yes. Right now, we launched the website in late May and started taking one-on-one calls in June, and have about 1,000 individuals signed up for the beta list and waiting to get on. And I'm really proud of that number. And it's happened over maybe hundreds of one-on-one calls with patient advocacy groups, with physicians and so forth. And so we don't have too many stories. Right now, we have family members, both the co-founders, we're on the app, just kind of doing the final testing and bug fixes and cleanup and things like that. But yes, I have an individual I will not name, but that when they were my age, they had a serious heart attack, cardiac event in their mid-30s, and have been, going to a cardiologist maybe every 6 weeks since then. The first thing when he gets into the app, you connect your medical records, you connect your wearables, and the first thing it does is it say, hey, we found a cardiac event from 13 years ago. And you've taken this medication, this medication, this medication, and then you switch to these medications on this day, and then you change your stint on this day, and your most recent blood test says X, and 6 weeks ago it said Y. And we do that without asking the individual anything. It's one of those things where, how did this thing just find this in my medical records and tell me about it? And then the next thing the app spits out is, we're getting your wearables data from your Whoop, your Oura Ring, and your Garmin and your Apple Watch. And here's some macro and micro data in terms of your workout tendencies and trends over the past however many years, right? So just on as a basis point of saying, hey, this is where we're starting. This is connecting the dots and putting all this data in one place, and then enabling that user to ask questions on this data, right? So as if you're asking WebMD or ChatGPT, or when you say, why do I have a headache? It's like, well, let's see here. You've been on these medications, and these are you had a heart attack on this date. You had this stint taken out. Actually, you took prednisone 6 months ago, and the side effects of that, it's probably why you have a headache. Instead of, you might be dehydrated, you might be malnourished, you might be sick, right? This whole idea of kind of personalized chronic care, as if you're asking that question to a physician who's looking at your charts and actually having access to that level of data. And so for him, it's I have a couple others too. Like I have another person who's on the beta. A family member, unfortunately, was diagnosed with prostate cancer very recently, and had his prostate removed. And the amount of questions you come out of that scary meeting, I can only imagine the scary meeting you find out about it, and the amount of Googling and calling around and just asking third parties, what does this mean? What is this? How can I improve this? And being able to go, okay, no, this is like, these are your test numbers. These are your scores of that test. And this is an answer to that question that's actually rooted in your test results, not some random LLM that's on the internet.
Not
And again, that individual, to call a spade, I don't want to get too in the weeds here. He's going to probably watch this. It's very, I'm not going to say shy, because I've never gone through anything like that. I'd probably be very shy too, but not really wanting to share that information, even with loved ones. And And so it's one of those things where if you were to, in theory, take that lab result and take your Apple Health data and throw it into ChatGPT and ask the same kind of questions, you're going to get similar answers. But now it's out in the cloud. Now people know about it. Now you start, you'd be scrolling on YouTube, and all of a sudden you're getting an ad for whatever, some prostate removal procedure or something like that. And so for newly diagnosed individuals, and I have a friend on it who's T1D and kind of a biohacker, who's been for 40 years managing diabetes, and just the way to have, I have my
type 1 diabetes.
Yeah.
Without insulin.
T1. Yeah. And so, trying to bridge the gap between all of the things that, so many wearables, so many fitness apps, and having all that data in one place, as opposed to, he's like, dude, I have like 15 fitness apps. This guy's super fit and jacked, a true kind of biohacker kind of guy. And just, I can ask one question to this thing in the morning and it can scan through all of my apps. I don't need to get into my Peloton app or then my Strava app or then my Fitness Pal for calorie counting. It's all there in one place, right? Huge benefits to some of those individuals.
And 5 different EHRs.
Yeah. Not to mention, you can have 5 different my charts. If you I've lived in Utah, I've lived in all over. I have the University of Utah my chart. I have a Stanford my chart. I have UCSF my chart. It's crazy, and you can't access all of that data. Even though maybe I had a rash in Utah, I had a different condition here. You can't get all of that data in one place, which is kind of absurd to me. Yeah. So it's at the same time as collecting wearables in one place and all that siloed data, it's a kind of a universal patient portal, if you will, as well. One-stop shop for all of the EHRs, or a lot of them.
We have done patient journey studies for chronic conditions, and the diagnosis takes that long because we are not able to connect the dots from last 15 years. If we had all those data points, we'll know exactly what happened. But every time it's a restart of diagnosis. What challenges do you anticipate going forward for Savva?
I think this is a consumer-facing tool. To call a spade. This is, my co-founder and I's kind of first foray into consumer-facing tools, where for, I think, user adoption is definitely probably the top of the list there, right? It's one of those things you can throw things on the internet or on the app store, but if you make it, that doesn't mean people will come. And so, and also at $5 a year, right? Not only is that price point, we're thinking to be inclusive of everybody to be able, like you said, for less than a coffee to be able to download the app. We can't really afford to do random ads across the internet. To see, are you managing diabetes? Do you want to share your medical records? Not only do I think ads wouldn't work, and it's like we need to play into the empathy, and this is more serious than just approaching random strangers off the internet. And so if we were running ads, I'd probably have to spend $40 a month as our cost, just because we're going to spend $35 per customer to even find them. And so we're doing this organically, right? Via podcasters as nice as you, and via one-on-one communications with physicians. Hey, try this out as a patient. Feel like there's a huge value add to say, if you have a cardiologist and you've got a patient rocking a Garmin who's dealing with heart disease, we'd love for you to talk to them about this and bring them our way. But the scary kind of thing in terms of when we launch this thing, we have 1,000 people on it right now, and hopefully by the time we launch the beta or the real product later on, we'll have thousands of evangelized people who are willing to kind of act not really as influencers, because don't really know what that means, but just people who are key opinion leaders in the space that are willing, hey dude, this is a pretty cool product, and do a review or post, hey, check out Savva. And if we need to do this over the course of years and years, we'll do that. But I think that's probably the scariest part of this. From a healthcare system perspective, again, we're launching in almost 300,000 doctors' offices, clinics, and hospitals. So that used to be a big concern of ours with previous companies, but the ONC Cures Act kind of allows us to get access, as long as you work with the FHIR standard and interconnect servers and do all that stuff on the back end. My co-founder Amit really knows how to do really well. I'd say that's probably our biggest challenge.
Fully appreciate that B2C is a very different ballgame. And before we move away from Savva, I just wanted to say how critical it is to think ahead about the security and access and everything, because everything is going to become more and more difficult. And I want to pin this, since we spoke last time to now, the pre-existing condition has become such an important topic because of the politics. So if we had spoken, okay, hey, pre-existing condition is not an issue anymore, but the way things are going legislatively, pre-existing condition can become an issue. So we cannot make risky decisions based on the current conditions, but the worst case condition that can be in the future, and things can change like within a week. So that's like mind boggling. So I just wanted to put a pin on that and make sure that what you were thinking is actually panning out right now. Going into future vision and advice, I will try to make this one. So you have traveled on 14,000 foot peaks, and
Yes,
you are
sir.
a skier who can like flip, right? Perhaps backflip too, right? So you are not averse to risk. So what is the balance for leaders and entrepreneurs to have when you are not averse to risk? I will walk into Home Depot and take all the risk possible. And when you're coming into healthcare, how do you say you balance that less over, like, I'm not risk averse, basically, but you also need to be risk averse. How do you balance these two competing things when it comes down to health tech? What would be your advice for entrepreneurs to go do it, but watch out for this?
I feel like there are more risk averse human beings on this planet than not. And so
Okay.
I think to go that way first, there's so many things, there's so many systems in place, people in place that want to shoot down your dreams, and they want to, oh, that's been done before. That's my favorite thing that happens when you're talking to someone, but like, no, it hasn't been done before by me. It's this mentality that a lot of people get. And again, I credit this to, traveling through Vietnam by myself, the first doing that thing. It's just like, oh, it's a scary place, communist country, blah, blah, blah. I'm going to go see that for my own eyes. And to be able to take that leap, a lot of people are unable to do that because they've been ingrained since they were kids by whether their parents, their teachers, their peers, where like, don't do that. Oh, that's scary. Steve Jobs has that famous quote. It's, the people who change the world are actually
Well, that,
the crazy ones that actually think they can. And
yeah.
so that kind of came to me, like I showed up at Home Depot's corporate headquarters and I was so confident that's a good product for them, good fit for what it is. I knew it would happen. And it's that level of conviction that I think people kind of lack. And I think it's from a variety of reasons. And I don't know if it's the way that I was raised, my parents kind of always being like super supportive of anything I'm trying to do, which has been the case for me, luckily enough. But I think that's the first and foremost, the biggest thing is that people just, they're afraid to take that first step. But like once you take that first step, you go, oh, wow, there's ground there. And then you keep going and then you start running. And so I'd say that that's the first thing you have to kind of consider is that you have to do things that don't scale. You have to put in an incredible amount of time and energy. And if you're not willing to do, those two things, then you're probably not going to get out the front door. But you're right. You can't just be this like, we're not in the circus here. It's one of those things where you have to kind of be very, especially in health tech. I mean, we're talking about some
Absolutely.
serious stuff here. We're talking about one of the most overregulated, maybe overregulated is not the right word, but the most regulated
It
industries in
is
the world.
regulated,
Maybe
highly regulated. Yeah.
aerospace and like
Sure.
health tech, right?
Aerospace,
It's like,
yeah, finance, aerospace, health. Yeah, it's like,
yeah,
yeah.
exactly. It's
Yeah.
crazy. And
Yeah.
so I'd say I'm really lucky. You haven't met Amit yet, but my co-founder and we are polar opposites in that sense. He's
Okay.
he's a risk taker. Don't get me wrong, but he's like so conservative and like thinks so hard about things before he does them, and he's so methodical about. He's an engineer, and I think that that's a huge part. I mean, first of all entrepreneurs need a co-founder, right? I totally believe in like that Y Combinator, school of thought that you need someone else. And for me, I think that the fact that we're completely on like opposite sides of like everything
Okay.
really helps us as every day we come in here early in the morning, and again he's driven and he takes risks, but he's also like, hey Steve, maybe you could think about X, Y, and Z. And I think that's a very valuable thing to have, but you can't I just say, more so than not, entrepreneurialism is about taking risks. And it's more important to be risk averse than to be overly conservative and to be worried about things. Okay. That's again not right or wrong. Just that's my take on it.
And that's fine. And I think you highlighted a very important point that you also have a balance as a team, right? Not everyone can be everything. So I think that is super critical point that you touched upon. And my one but last question is: you are among the few who has gone into an industry, as you said, like I didn't even know how to ship things, right? There is a huge amount of uncertainty, but you figured it out, right? So there is a characteristic about you that, hey, I can figure it out. And you are also among the few people who are in wellness, healthcare, and health tech as well right now. And there is too much uncertainty here. So from your perspective, where do you think we are going to end up? Where do you think we should end up? What do you think we should do now to make sure that we end up where we should end up?
I've got one other to redeem myself after this.
Okay.
And I think it goes into what we were talking about earlier about this shift. It's an undeniable shift into this value-based care model. I think there's a lot of people out there that don't even understand what that means still. Maybe they've heard it in the news a couple of times, but value-based care is not going away. And, just to put it out there, my take on it, instead of having a menu item, like, okay, once this guy's screwed up, we're going to have an MRI for this much. We're going to have an x-ray for this much. We're going to have this much medications, this many visits this year. And that's what it's going to cost you. At the end of the day, you're like, here's the menu. This is what it costs you, versus this whole shift to like, hey, incentivize your primary care provider or whoever it might be to keep you as healthy as you can, to have, instead of taking 15 minutes with you on your one visit a year, I'm going to spend 40 minutes with this guy so that he doesn't come back in the whole year, and he does all the things right, and he understands the advice that I'm giving him, as opposed to get in, get out. We'll see you again when you get screwed up and you forget what happened in here today. And right, that's I think is the biggest shift that we're seeing, and I think it's undeniable. I got a lot of intelligent, way more intelligent than me on every level, people that are on the beta I've been talking to, and there's a lot of people out there thinking that insurance might do that complete 180 flip in the next 10 years. And I agree, especially as this patient-centric approach starts happening, and holistic medicine has had like a negative connotation for a long time. Sleep, exercise, diet, just do these things and live longer. The whole blue zones thing. We got that dude on Netflix, whatever his name is, trying to live to be 100 and whatever.
Yeah.
Right. This whole shift into longevity and preventative care. I think that it's not going anywhere. I think that the entire world will follow in the footsteps of what's happening here in the States with that. Not to say that we're ahead of other countries, but this whole value-based care model is something that is undeniable, that is here, that is, every day getting more momentum, especially with, companies like ours coming out. And
no, it is a really good a really good answer, because it kind of sparked something thought process in me, and hopefully for the audience as well. Basically what we are talking about is we are incentivizing doctors to see patients more times rather than see them only once and not have patients to come back. It is technically, I know doctors are super busy. They're not going to, if they don't want patients to come back. But still, the incentive is really in seeing more patients than seeing fewer patients.
Let's not worry about replacing Steve's lungs 20 years from now and like that $20,000 line item. Let's get Steve to stop smoking and to start walking more. And
Exactly. And also there is a thought process with the insurance companies, if you think about it. But preventive care is not the priority, because there are a lot of acute conditions that we have to take care of first. And then investment in the preventive care becomes a thing. But you are making preventive care accessible, so that's kudos to you. And technology enables that. So that's where I think you, as a health tech hero, play a big role. You have 90 seconds as a last question. If I've missed something during my questions, or reiterate anything that you deem very important, the question is yours, the answer is yours, and the stage is yours. It does not have to be 90 seconds, but the stage is yours.
Awesome. Thank you so much for having me. I can't wait to meet you in person one of these days. If you're ever in Northern California, or if I'm ever in Southern California, I got to make sure we link up. I'd say to your audience here, we're doing this organically. If any of these things we've said today are of interest to you, please reach out to me. I'm super available. You can book an appointment with me right on LinkedIn. And again, I have dozens of calls with people from all over. It's like, if you're an individual patient and you're curious about this, if you're a physician or a key opinion leader, whoever you are, a patient advocate, a cancer coach, I'm at your beck and call, and I'd love to talk to you about this. Our beta is open, right? We've been enrolling people in it, and without getting too salesy, if you go to www.savva.ai, you can sign up for the beta there. You can also get in touch with me or my co-founder there as well. If you have anyone in your life that's, whether they're a biohacker or they're managing a chronic condition or they're recently diagnosed, or maybe they're a new mom or they're an expecting mom, we see a lot of value added there. Please share this with them. Let them know that this is coming. And, we're hoping that, over the next several months of the beta, it's an inclusive beta. We want to hear your feedback. We have forums prepared to see that, we'll make changes to our mission, to the tech, to the capabilities based off the feedback we're getting from individuals. So please join the beta. Doing this again organically. We're not going to send you ads one day. We feel like $5 a year for the premium. Most of the app is free, but to ask the app questions, it's going to cost $5 a year. And please don't hesitate to reach out to me. And we hope to see you on the Savva beta test one of these days.
And with that, Stephen, thank you very much. I anticipated this call to be a very educational call for me, and it was. So thank you.
Fasa, thank you very much, and have a good rest of the day, and we'll talk to you soon.